Hello, my friends. I'm Dr. Julia Parker, urologist and senior health educator. And today we're going straight to the point. At 70 and beyond, your medicine list should not be a puzzle that steals clarity, balance, and freedom. Not every symptom deserves another pill. Not every pill needs to stay forever. And not every routine is the same as safety. This episode is called Polypharmacy Pitfalls: How to Simplify Your Medicine List at 70 plus, because I want to give you, clearly and practically, a roadmap to cut risk, feel more energetic, and make smarter decisions with your clinical team. This is not personal medical advice. It's a well-being guide grounded in safety principles, common sense, and accessible science. Never stop a medication on your own. Bring these ideas to your next visit and turn them into safe, personalized actions. For years, many older adults were told that more prevention meant more prescriptions. But experience shows something different. The prevention that works is the kind that simplifies, prioritizes, and respects the body you have today, not the one you had 10 years ago. Let's start by breaking a common myth that a longer medicine list equals better care. Evidence and everyday practice point to something else. Past a certain age, the cumulative risk of adverse effects rises with every added drug. Drowsiness, dizziness, falls, confusion, constipation, bleeding, interactions you didn't see coming. The goal isn't less medication for the sake of it. It's better medication so you can live more freely and more awake. Picture a very concrete scene. You open the bathroom drawer, and there are blister packs, bottles, and loose tablets you barely remember starting. You sit down, breathe, and ask yourself, does this help me today? Do I still need all of these? Asked calmly and then discussed with your healthcare team, that question can change your year. Because simplifying is not cutting for the sake of cutting. It's deciding, with criteria, what stays, what adjusts, what can be taken as needed, what can be replaced by a more effective habit, and what can be retired with a gradual plan. Let's define the problem with everyday examples that might feel familiar. You've used a sleep aid for a while, you wake up groggy, your balance is shaky, and by afternoon, you need coffee to keep from nodding off. You added a pill for heartburn, but the heartburn came mostly from late dinners and that second glass of wine. You were given an analgesic for your knees. Soon after came constipation and then a laxative, just in case. One morning you got dizzy, your blood pressure was on the low side, and your clinician had to adjust the dose. These are real-life stories of polypharmacy, a chain where one drug opens the door to another, and then another, until no one remembers the first domino. Over time, that chain drains energy, complicates memory, and erodes the confidence to move, go out, walk, or travel. Here's the liberating part. There are simple, repeatable, safe steps to loosen the knot. It's about reviewing, prioritizing, discussing, and planning. Through this episode, you'll learn a 6-move process: honest inventory, clinical priorities, minimizing duplications, smart substitutions, safe tapering, and active monitoring. Each move serves a specific purpose. Each decision reduces noise. Each adjustment translates into clearer thinking, better balance, smoother digestion, better sleep, and more interest in everyday life. First move, honest inventory, also known as the brown bag review. Yes, really. Put every medication, vitamin, drop, ointment, and tea you use sometimes or just in case into a bag. Include the things prescribed years ago and the things a friend recommended. Don't leave anything out. Writing it down is even better. Name, dose, frequency, and the original reason. The goal is to recover the story. When did it start? Why did it start? And has that reason been resolved? Many people keep taking something for a symptom that no longer exists, or at a dose that no longer matches their current weight, kidney function, or blood pressure. Health changes. Needs change. The list should change with them. Second move. Clinical priorities. Ask this key question of each medication. What important benefit does this promise me now? If it prevents a serious event or controls a condition that truly changes your life, keeping your pressure safe, managing atrial fibrillation, preventing a flare, then it's a strong candidate to stay. If, on the other hand, a medication only targets a mild annoyance that you could handle with a daily habit, like eating dinner earlier, hydrating better, taking a 15-minute post-meal walk, or slightly elevating the head of your bed, then it may not deserve a permanent spot on the shelf. Prioritizing isn't reckless. It's directing resources where they yield the most. Third move, minimizing duplications. Many lists hide drugs that do the same thing via different routes. 2 antihistamines, because one's for day and one's for night, 2 different acid reducers, 2 painkillers with overlapping side effects, drops and tablets with the same active ingredient under a different brand name. Your clinician and pharmacist are invaluable allies here. The aim is to keep the fewest necessary active ingredients at the lowest effective dose on the simplest schedule to remember. Simplification doesn't only reduce risk, it also improves adherence. A plan you understand is a plan you follow. Fourth move, smart substitutions. Some medications meet a real need, but at a high cost for the mature brain, blood pressure, stomach, or balance. The good news is that there are often gentler alternatives. Here are practical examples without long technical lists. If sleep is poor, but your real enemies are late dinners, blue light screens, and a 90-minute afternoon nap, the sleeping pill starts at a disadvantage. Tweaking your home lighting, eating earlier, taking a gentle post-dinner stroll, practicing slow breathing, and trimming the nap to 20 to 30 minutes can have more impact than a capsule that lends you sleep tonight and returns grogginess tomorrow. If heartburn visits at night, elevating the head of the bed, eating earlier, and reducing alcohol often beat adding another pill. If your knee aches chronically, building strength with guided exercise, using local heat, and pacing your walks with firm footwear is, long-term, safer than escalating painkiller doses month after month. Fifth move, safe tapering. Sometimes it's wise to say, "Thank you, I don't need you anymore," to a medication. But how you do it matters. Some meds can be reduced over weeks, others require a slower plan. Most important, don't do this alone. Bring a specific taper schedule to your visit. Dose steps, review dates, and warning signs. A well-designed taper avoids rebound and teaches you to listen to your body without panic. A frequent gain of this phase is lucidity. As certain substances come down, the mind brightens, balance improves, mood steadies, and the bowels cooperate. Many people tell me after a careful taper, "I feel back in my own rhythm." Sixth move, active monitoring. Simplifying is not make changes and forget it. It's watchfulness. In the 6 weeks after any adjustment, keep brief notes. Sleep, energy on waking, dizziness when standing, bowel movements, appetite, walking steadiness, attention while reading something simple. Write in short phrases. Less morning fog. Steadier on first steps. Hands less shaky. These notes turn perceptions into data. With data, you and your professional can refine the plan even further. Now let's talk about concrete benefits, one per section, so you can notice them in your own day without confusion. First benefit, balance and fall prevention. Many common combinations in people over 70, night sedatives, strong analgesics, certain muscle relaxants share an effect. They dull reflexes. As you simplify, that cotton in the head lifts. When you stand, the floor doesn't feel so far away. Climbing a step stops being a gamble. One fall can change the year. Avoiding it with a cleaner list can change your life. Second benefit, mental clarity. The mature brain loves light. As you reduce sedating or anticholinergic load, attention improves. Words that used to slip away return to their place. Reading several pages in a row becomes doable. You can finish a crossword without watching the clock. Everyday memory, remembering an errand or an appointment, gets sturdier. This change boosts confidence. When the mind is clearer, mood rises, conversation flows, and motivation to leave the house returns. Third benefit, digestion and regularity. Many hidden list effects cause dryness, constipation, rebound heartburn, or low-grade nausea that steals appetite. As you simplify, your gut regains its rhythm. Smaller meals, spaced out and chewed calmly, sit better. Mornings stop being a race to the bathroom. Clothes fit more comfortably. And nutrients absorb more efficiently, which shows up as steadier energy, without another miracle supplement. Fourth benefit, steadier blood pressure and fewer dizzy spells. Drug interactions can turn your pressure into a roller coaster. Adjusting doses, removing duplicates, and checking timing smooths that curve. You stop getting up with a floating head. A walk to the market doesn't demand a wall break. Better hydration and a few leg movements before getting out of bed complement this effect. A body that feels stable moves more, and a body that moves more sleeps better. Fifth benefit, fewer urgent visits for preventable effects. Simplifying lowers the odds of confusion, double dosing, and cascade reactions. That Sunday you planned with your grandkids doesn't get handed to a waiting room. The peace of mind is not small. Knowing you own your routine, understanding why you take each item, and being able to explain your list in 2 minutes is a very concrete kind of freedom. Sixth benefit, saving time and money. Reducing unnecessary medications frees budget for 2 evergreen investments, real food and planned movement. Aim for adequate protein at each meal, vibrant vegetables, whole fruit, quality fats, and enough water. Add gentle sunlit walks, strength exercises with bands or body weight, heel-to-toe balance while you brush your teeth, and slow breathing before bed. These decisions multiply the effectiveness of the meds you truly need and often let you stay on lower doses for longer. Let me give you a conversation script you can bring to your next appointment. Arrive with your written list, breathing calmly, and say, "I'd like to review my medications with one goal. Keep what's essential for my health today, reduce duplications, and plan safe tapers for what I no longer need. Can we do this together?" Then ask 9 simple, powerful questions, 1 per medication. 1. What key benefit does this give me now? 2. How long until that benefit shows up? 3. What side effects should I watch for at my age? 4. Is there a lowest effective dose we could try? 5. Could we switch to as-needed use instead of daily, if safe? 6. Is there a gentler alternative for my brain/balance/stomach? 7. If things go well, when do we reassess continuing? 8. What would a gradual taper look like? What steps over how many weeks? 9. What early warning signs mean I should call you sooner? This script makes you the protagonist without confrontation. Good clinicians welcome patients who think, ask, and participate. To reinforce the message, here are 3 brief, inspiring cases that show how simplification turns into everyday well-being. Case 1. Martha, 74, had added pills to her life almost without noticing. A night sedative, a daily antacid, and, in case it hurts painkiller, allergy drops. She walked staring at the floor. Her daughter noticed she repeated stories. They decided to do the inventory. In clinic, we set priorities. Retrained Martha's nights, warm light, earlier dinner, light reading, raised the head of her bed a bit, added a short after-dinner walk, and designed a gradual taper of her sedative. In 4 weeks, Martha said, I wake up clearer. At 8, We stepped the antacid down to as needed. What surprised her most was her mood. I'm enjoying breakfast again. Case 2. Ernest, 79, lived in fear of falling. He took 2 different painkillers, a night muscle relaxant, and a bladder pill with drying effects. We mapped everything. A physical therapist built a glute and calf strengthening plan with home balance routines. His doctor swapped the relaxant for local heat and pre-bed stretches and set a careful reduction of the drying drug that worsened his mouth and bowels. In 6 weeks, Ernest walked more upright. I step onto the bus with confidence, he said. His confidence changed his calendar. He returned to the Domino Club. Case 3. Alice, 82, felt dimmed. She took a sleeping pill, an older antidepressant, an antacid, and a motion sickness drug she used just in case before going out. The inventory revealed silent brain load from overlapping effects. With her geriatrician, she reformulated the plan: sleep hygiene, morning light, companion walks, music, and a review of her antidepressant toward a more modern option suitable for her profile. They stopped the motion sickness drug that made her dizzier. In 2 months, Alice was reading poetry aloud at a local group. My head feels more like mine, she told me. That feeling is common when the list aligns with the real person. Now a few simple, high-impact practices that reinforce simplification. First, the one new thing at a time rule. If your clinician proposes changing 2 or 3 items, negotiate to introduce them in stages. That way, you'll know what helps and what doesn't. Second, a visible dosing calendar with boxes you tick. Physically ticking boxes helps memory and prevents double dosing. Third, the 90-day check. Each quarter, ask about the relevance of every medication. Does it still make the same sense? Have your pressure, weight, kidney or liver function, activity, appetite, or sleep changed? Fourth, strategic hydration. A mature body doesn't like dehydration. It intensifies dizziness and constipation and makes meds feel stronger. Small sips during the day are gold. Fifth, minimum necessary movement. I'm not talking marathons. I'm talking micro actions. 10 to 12 chair-assisted squats, 5-minute walks after meals, 1 flight of stairs if balance is safe, heel-toe rocking while you wait for the kettle. Movement makes your entire plan more efficient, from blood pressure and blood sugar to sleep. Let's also face 3 common fears that slow simplification. Fear 1. If I stop something, the symptom will come back worse. Sometimes there's a brief rebound. That's why taper schedules and support exist. We're aiming for the sweet spot where benefit is maintained with the lowest necessary dose, or with habits that hold the result without baggage. Fear 2. My doctor will get upset if I ask. Good clinicians prefer honest questions to dangerous silence. Arriving with an organized list and a clear intention makes everyone's work easier. Fear 3. It's too late to change. It's never too late to regain clarity. I've seen meaningful improvements in people in their mid-80s and 90s after a simple, respectful review. Here's a helpful mental framework for decisions. I call it the 5 Ds: diagnosis, drug, dose, duration, deprescribing. 1. Diagnosis. Was the original problem well defined? 2. Drug. Is this really the best choice for that indication in someone your age with your other meds? 3. Dose. Is it the lowest effective dose or more than you need now? 4. Duration. How long was it intended for? Did anyone check the clock? 5. Deprescribing. If it has served its purpose, what's the plan to retire it without rush or setbacks? Repeat this cycle for each item. In practice, most simplification happens through small, stacked decisions, not grand gestures. Let's talk about supplements, because they count too. Many older adults take multivitamins, herbal capsules, joint powders, or brain boosters without checking interactions or doses. Not every supplement is harmless. Some amplify blood thinners. Others alter blood pressure or irritate the stomach. The rule is the same. Anything you take belongs on the list and should pass through the same filters: priorities, duplications, substitution, and monitoring. Sometimes upgrading breakfast, adequate protein, whole fruit, and fiber does more for your joints than the fanciest jar of the month. If you feel drawn to simplify but don't know where to start, here's a 7-day prep plan for your next appointment. Day 1, complete written inventory. Day 2, group by function: blood pressure, sleep, pain, stomach, mood, allergies, bladder, vitamins. Day 3, 1 sentence per item. I started it for today, it gives me effect I don't like. Day 4, record 24 hours of basic rhythms: sleep hours, naps, walking, water, meals, evening screen time. Day 5, outline goals: steadier balance, clearer mornings, less constipation, natural sleep. Day 6, write your 9 questions for the clinician. Day 7, choose a trusted companion to attend the visit. 2 sets of ears hear better than 1. Showing up with this work done saves time, reduces confusion, and, most importantly, puts you back in control. Before we close, here are supportive phrases to repeat while you make changes. My body changes, so does my plan. Less noise, more life. Clarity today, confidence tomorrow. Asking questions is self-care. Step by step is enough. These aren't magic, but they sustain your morale when the calendar shows weeks and you're still adjusting doses. Simplifying is a process, not a single act. And something else that matters: caring for your medicines also means caring for your relationship with time. Sleep at similar hours, eat seated and unhurried, have calm conversations, look at the morning sun, water a plant, tidy a drawer, call a friend. Small, repeated actions create an environment where your nervous system slows down. In that environment, any necessary medication works better, and any unnecessary dose becomes obvious. If you're a caregiver or family member, your role is valuable. Don't decide for the person you care for, decide with them. Help with the inventory, join the appointment, take notes, ask about early warning signs, celebrate each adjustment that brings relief. Simplification is an act of respect. It recognizes an adult with history, preferences, and projects. Yes, at 70 and beyond, there are projects. A clearer list leaves room for them. Let me leave you with a final image. Imagine walking down a bright hallway. In your hands, a short, legible list of names you understand. Your footing feels steady. Your breathing is broad. You pause at your door, take a deep breath, and smile. This makes sense. That feeling is the real goal of simplification. Your health plan represents you instead of ruling you. Let's wrap this in one powerful line. Simplifying your list at 70 plus is not giving up on care. It's sharpening your protection to gain clarity, balance, and life. It's never too late to regain vitality. With good questions, prudent steps, and habits that truly transform, your days can feel lighter and your nights more peaceful. If this episode brought you clarity, I invite you to reflect on your own list. Share your experiences in the comments, what's worked, what you learned, what still confuses you, and subscribe so we can keep building a mature, clear, low-noise approach to well-being together. I'm Dr. Julia Parker. Take care of your present. It's the best place to grow older with confidence.